Good morning, everyone. Welcome to Brainwaves. In previous Brainwaves features, I've profiled a few different software programs for training the brain to help people with mental illness work toward their recovery better. Um, and there's been a proliferation of apps like these. Now many are appearing on mobile devices. And how do you keep track of so many new brain training programs and apps? Well, now there's a website for that. It's called cyberguide.org, psyberguide.org. And it's the brainchild of Matt Bowman, who is a director on the board of IMRO, and it's now a project of IMRO. CyberGuide rates and reviews apps and software for brain training and other means to help people with mental illness toward their recovery. So with us today is Dr. Michael Knable, who is a great psychiatrist and also he also works toward improving behavioral healthcare systems, and he's done a lot of great contributions toward helping people with mental illness improve their lives and improve their recovery prospects. So Dr. Knable, thank you so much for being with us today on Brainwaves.
It's a pleasure. Thanks for inviting me.
You bet, yeah. So Michael, can you please tell us in some detail what the CyberGuide website is, and also why it's such a potentially helpful service for people who have mental illness?
Well, as you mentioned, this was the idea of Matt Bowman, who has family members affected by mental illness and has a long-standing track record as a philanthropist and interested party in moving research and treatments forward. And originally, the idea was to help people make decisions about what products might be most useful to them and to their families. The biggest problem is that these products are being developed kind of rapidly, and they're coming on the marketplace usually without the kind of testing that we see, for example, with medications or even with certain kinds of psychotherapy. They are not usually tested with clinical trials, and so then it's kind of buyer beware, and it's left up to the individuals to decide whether one product is better than another. So we wanted to make an unbiased clearinghouse consumer reports kind of website where people could see lists of products with a good description of what they do, a collection of scientific publications, bibliography that back up the claims of these products, and then certain kinds of ratings, sort of like an Amazon.com type rating of the products themselves, so people could at least see what other people are saying about them and try to make an informed decision.
Sounds great. Sounds very useful. So, what sort of software and apps are you rating so far on the CyberGuide website?
Okay. Well, originally we started off focused on schizophrenia, and as I think you have profiled in some of your previous programs, there is kind of a body of work that has built up around the idea of cognitive remediation in schizophrenia. So these were initially programs to help with the so-called negative symptoms of schizophrenia and the cognitive memory, attention, working memory, executive function problems that go with the illness. And so that was where we started, and we tried to make a description of all the products that are available in that realm, the science backing them up, and that was about 12 products altogether. We surveyed the literature. We took all the publications about these technologies, and we found all of the scientists who had authored the papers, which totaled about 70, and we went to them and asked them to fill out a survey rating certain aspects of the products. And that was our first attempt at what we call an expert consensus rating. And that is shown on the current version of the website in a star kind of system, or 1 to 5 stars on 3 different aspects of the programs. Its utility in changing certain symptoms, the design and user experience, um, and a couple of other features of those products themselves. Um, Now, many of those products are meant to be used in clinic settings or in group or rehabilitation settings, and they were not originally meant to be used by individuals themselves. So another growth of this field is increasingly things that people can use on their own without the help of a professional. And that, I think, is extremely attractive to many people suffering with these conditions and their families. It sort of empowers them to kind of take control and treat their illness in their own sort of environment, in their own way, without having to go to an office, without having to go to a hospital. Um, so we're trying to now move into surveying that world, which, as I mentioned before, is coming very rapidly into mobile apps, smartphone apps, and similar kinds of applications.
Sounds very, very helpful for a lot of people. And of course, so if people start using these apps at home by themselves, then this will help manage the caseload of psychiatrists like yourself, I suppose, in addition to improving the lives of people working on their own toward their own recovery. So is this part of what attracted you to work on the CyberGuide project, or?
Well, I think there were two aspects. One was simply, patients would come to me and they would say, "I've been reading about this. Which one do you think is best? Which one should we buy?" And frequently, I wouldn't have any data to give the answer. So I thought, well, if we got expert ratings and we got consumer ratings, we would at least have that information to help guide us. The second point was I read an article about the availability of mental health services in the United States. And what I learned was about 55% of counties in the United States do not have a single psychiatrist, psychologist, or social worker. So that means for many people to get advice or to get a consultation, they have to drive a long distance. And maybe they drive a long distance and they get a prescription, or they get one session or one evaluation, and then a month goes by before they get another session. So uh, there's a growing impetus in our field to have telepsychiatry, e-mental health, remote systems where you can either work on problems on your own, or you can use those systems to keep in contact with your providers, whether it's a psychiatrist or a psychologist. So that became very interesting to me. And even I live in a big city, and even in a big city, coordination of care between hospital, partial hospital, outpatient clinic is very difficult. And so these electronic applications can make that function much more efficient.
So currently, CyberGuide focuses on applications for schizophrenia. Do you plan to add applications for other mental illnesses in the future?
Yeah, so the first pilot version of our website came out about 6 months ago, and it had the schizophrenia descriptions that I mentioned to you. And we've just recently, within the last few weeks, launched a second version of the website that has expanded into mood disorders, PTSD, and anxiety disorders. And we have about 50 products listed there now. Although we don't really have expert consensus ratings and bibliography yet on the mood and anxiety applications, but mood and anxiety are growing very rapidly. A lot of new things are coming on the market quickly. So we're trying to, well, we've got the product listing up and running, but we have to do the rating and the bibliography part in the next couple months.
Good, good. And viewers, if you go to the CyberGuide website, which Michael will tell you the URL for in just a moment when I ask him, and you like it, if you enjoy its services and they feel they help you, please tell your friends and people who know about the site, so that it can start to help even more people. So, Michael, what's the URL for that site, please?
It is PSYBERGUIDE, cyberguide.org.
Okay, great,
Yeah.
thanks. So cool. So I hope I hope a lot of people will check it out. And Michael, if people have questions for you on the Brainwaves page when I publish this video, will you be willing to answer some questions?
Absolutely. Yeah,
Uh,
absolutely.
okay, great. Thanks so much, Michael, for being on Brainwaves, and um, I hope to talk to you soon.
Thank you very much. Have a good day.
You too.